Navigating the world of healthcare and retirement can feel overwhelming, but today's episode is dedicated to simplifying it for you. We have found that health insurance is often greatly misunderstood by retirees and leaves many unsure of their options. And so today, we're here to clarify the essentials. In this episode, we'll dive into key topics like securing health insurance before reaching Medicare age 65, understanding the Affordable Care Act, what it is and how it works, exploring COBRA health coverage, and providing a quick primer on Medicare. I'm Alec Quaid, Certified Financial Planner and Wealth Manager with Potterack Capital Advisory, and joining me today is Amy Green, a health insurance expert with Move Health Partners. Move Health has been a tremendous partner to our firm and helped guide many of the families we serve through the complex world of health insurance. So, Amy, let's jump right in and let's talk about health insurance before age 65. This is something that we run into a lot of clients retiring before Medicare age 65, really confused about what to do with health insurance, sort of overwhelming, sometimes even fearful of retiring because of having to pay for health insurance. So you've dealt with this a lot. Tell us and tell our audience, what are their options and what should they be considering if they're retiring before Medicare age 65?
Absolutely, and thank you for having me today, Alec. So everyone knows that when you separate from an employer, you have COBRA. Well, what is that? It is a set of laws that allows you to keep the health coverage that you have as an employee. The only difference is that you pick up the full cost. So your employer has been paying a portion of that, you're going to pick that up. And that is where a lot of the fear from early retirement comes from, is they see how expensive COBRA is and they don't realize that you can actually get health insurance for less. Now you can also shop on the Affordable Care Act, and 90% of Americans would qualify for tax subsidies through the Affordable Care Act under the Inflation Reduction Act. So that means that based on your income, you could see a reduction in the cost of your monthly premium for you and your family. And we can help you navigate that and help you understand what all the different laws are and the regulations, and you still have that same 60-day window to decide your coverage.
So is it really just either I'm choosing COBRA or I'm choosing the ACA? Those are really my two main options.
There are some alternative options as well. A really popular one is faith-based sharing programs. They tend to be lower cost and more attractive to folks that are maybe planning to have a higher income in retirement, and maybe the subsidies don't work for them, or they want to travel.
Okay. So it's sort of, those are my three options, though, if I'm retiring before age 65.
Essentially, yes. I mean, you could self-insure, but that's kind of dangerous because the benefit to having health insurance is you're essentially creating a stop loss for yourself. At some dollar amount, you will no longer be responsible for your health costs. So right. If you don't have health insurance, you're not getting network discounting. You're not getting hospital discounts at all. Sometimes the hospital will discount you a little bit if you are uninsured, but you're still going to have to pay your share of that cost until the end of time, apparently.
Mm-hmm. No stop loss is the key there.
No stop loss is the big
huge
thing.
Liability potentially if something were to happen.
Absolutely.
So let's dig into those three, just maybe a level deeper. So COBRA, I mean, is it different from employer to employer? I mean, does it just depend on the health plan based on how much it's going to cost? Tell me about that.
It does. So currently, employers are required to subsidize the health cost or the cost of your health plan based on 50% of the true premium. And in order to meet the current regulations with the Affordable Care Act, the cost of that plan can't exceed 9.5% of your annual income. So if you are paying, say, $200 a month, your employer is probably paying somewhere in the neighborhood of $1,500 to $2,000.
A month.
A month.
Okay.
So that may make you feel more valuable as an employee because your employer is investing those dollars in you. But when you separate, you pick up that cost. Now you get to keep the exact same coverage that you have, including any deductible that you may have paid or anything towards your maximum out of pocket. That can be really valuable for someone who is thinking of a Q4 retirement. So if you're thinking October through December, you're going to retire, COBRA may be what we recommend for you. Okay. However, if you're retiring in Q1, you don't want to pay dollars towards your annual out-of-pocket and then lose those dollars in the process. So it may be better for you to immediately transition to like the Affordable Care Act.
Okay. And how long does COBRA last?
Up to 18 months in most states. There are a few states that will allow up to 36.
And then when do I have to make that decision by after retirement?
Usually within 60 days. Now, currently, as part of severance packages, we are seeing that employers are choosing to continue subsidizing those premiums. Then you get a 60-day window from the date that the coverage is no longer subsidized.
Okay. So big benefit I'm hearing is I get to keep my same benefits, right? I mean, it's known benefits because it's what I've been using at my employer. So there's no changes there, price being or premium being the big change, obviously.
Absolutely. Now, the employer can change the health plan during any open enrollment. So if you notice every year you get a document that says, hey, you need to reshop your health insurance, your plan would change in accordance with everyone else's. So if you retire and then you've been on it for, say, 6 months, and during open enrollment, the employer decides to change the health plan or changes the premium, you either have to, A, move over to the Affordable Care Act, or B, accept whatever changes have been made.
Okay, gotcha. And then at the end of the 18 months, how does that work? Like, what do I do then?
Well, then you'd have to either go shop on the individual marketplace, and your COBRA ending is an opportunity for you to shop and enroll, or you'd have to go uninsured.
Right. Okay. But that's a qualifying whatever event.
Yep. That is a qualifying life event, yes.
Life event. There you go. That's the term. This is why you're the expert. So, okay, that's interesting. So then tell me more about the Affordable Care Act. You know, we hear all these terms like the marketplace and then the bronze, gold, the silver plan, and then every state's got their own exchange. I mean, I don't know. There's just all these things. What does our audience really need to know?
So the Affordable Care Act is not anything other than a set of laws that dictates what insurance companies are allowed to do in regards to health insurance that you obtain outside of an employer. So, for example, if you have pre-existing medical conditions or you want your preventative care covered, those things are required by federal law to be covered by any plan that is considered Affordable Care Act compliant. So what that means is if you are a cancer patient, you can shop through a marketplace, so that's like the exchanges through the state or through healthcare.gov in most states, to obtain your health insurance, and they cannot ask you any medical conditions or exclude any pre-existings. And every single plan, whether it is bronze, silver, or gold, is required to provide you with your preventative care at no cost to you.
Okay. And so then what is the difference between bronze, silver, and gold?
So there's an actuarial difference. So silver plans are kind of what they use as the benchmark. That is going to be very similar to like an 80-20 plan through your job, right? So essentially you're going to pay roughly 80% of your medical costs up to that dollar, or they're going to pay 80% of your medical costs up to that dollar amount, okay, whatever it might be. So you can anticipate you're probably going to pay about 20% of the charges. A bronze plan is roughly a 70-30, and then a gold plan is usually going to be a 90-10.
And is it pretty drastic differences in premiums?
So it can be. In some states, it is actually more beneficial for someone to choose a bronze plan because the biggest difference between a bronze and a silver is actually the deductible and the maximum out of pocket. So everyone gets hung up on, I want a low deductible. Well, what is a deductible? It's the dollars that you're expected to pay before the insurance company begins paying on your behalf. Okay, so you're getting your skin in the game. Mm-hmm. Aside from that, there is coinsurance, and that is what you have to pay in a split with the insurance company. So that's where the 70-30, the 80-20, and the 90-10 come in. There's also something called a maximum out of pocket. That is your stop loss. Believe it or not, on most bronze plans, currently the maximum out of pocket is $9,450, so $9,450 per person. On the gold plans, it's $9,400.
Oh, wow.
So there's really not a big difference. Now, the biggest draw for someone to choose a gold plan is there are some network differences. So, for example, in the greater Chicago metro, for many years, Northwestern Hospital Network only participated in the Blue Cross and Blue Shield of Illinois Gold Plan. That is the only plan they participated in. And for a 60-year-old male, it was $2,000 a month. So that's a big difference in comparison to like $600 a month for a bronze.
Yeah. So that's where the consultation with you and your team, as far as what specifically is needed for your health benefits, comes into play.
Absolutely, because what you need from your health insurance and what I need from my health insurance are two very different things. Insurance
Yeah.
isn't and shouldn't be one size fits all.
Yeah, definitely. Definitely. Okay. Well, so then how do these subsidies work?
So the federal government in 2010 signed into law the Affordable Care Act, and in 2014 the marketplaces opened. They also allow you to get advanced premium tax credits, which are used to immediately reduce the monthly cost of your health insurance. So if you think about it this way, you're going to tell the government, hey, I think I'm going to make $50,000 this year. They're going to say, based on $50,000, your monthly premium cannot exceed X percent of your annual income. Currently, that's 8.5% for the benchmark plan in your area. So I can't tell you exactly how many dollars every single person would get in subsidy, but I can tell you that no matter where they live in the country, the second lowest cost silver plan in their zip code will never exceed 8.5% of their annual income.
Okay. So when you say advanced tax credit, it's not like you have to wait to file to get that to offset your tax liability. It's just offsetting your premium throughout the year. That's what that means, right?
It is. And one thing that some people will choose to do as well is if their income is flexible or they're not 100% sure, they will say, I think my income is going to be, say, $75,000, and they may qualify for, say, $1,000 worth of tax credits. But they're debating on whether or not to maybe do a Roth conversion. So they may choose to apply for the credits now and then only use a portion of them throughout the year. And at the end of the year, they reconcile using a 1095-A form, which you file with your federal income taxes, and get those dollars back as either a reduction in tax liability or a refundable tax credit. So you can apply for the credits and not be 100% sure of your income and still be okay at the end of the year.
Okay. What if you're off on your income?
So if at the end of the year your income is lower than what you projected, you'll get a refund. And at the end of the year, if your income is higher than what you projected, you would have to owe the government back. But that's all things that we would explain to you and help you best navigate. Because like I said, not everyone's situation is the exact same. So just understanding what those requirements are.
Okay. Okay. Well, and before we move on to Medicare, anything else you think our listeners should really know about the ACA that we haven't hit on?
So I think the biggest thing is if you're planning on traveling outside of your state of residence, they can feel very restrictive. So if you're not going to work with someone here at Move, please make sure that you are asking really pointed questions to the people that you're working with and ask them, does this plan cover me outside of my state? Will this plan allow me the opportunity to seek the medical attention that I want? And ask them to explain to you the network type, because many people don't understand the difference between an HMO, a PPO, an EPO, and things like that. So just whoever you choose to work with, make sure you're asking questions, because if they're treating you like your question is not a logical one, they shouldn't be doing what they're doing.
Yeah. That's such a great point. I mean, I've met many retirees who aren't traveling around to different states or different countries.
Right. And the thing is, you can have a state-based plan and be okay. You should just be aware of what your restrictions are. For many, they're going to visit their grandkids 2 or 3 times a year, or they're taking their spouse out of the country for a holiday. That's okay. Just understand what your restrictions are.
Yeah. Fantastic point. Okay. So, Medicare. This could be a whole podcast on itself, but we're just going to hit the high points. You know, someone's getting towards 65. They're getting a bunch of stuff in the mail. When should the process for Medicare enrollment start, and looking at what plans may make sense, and sort of talk about how that works from the beginning, maybe when someone turns, 64, 64 and a half.
So ideally, first of all, please just stack up all that stuff you get in the mail, put it in the pile in the corner. We can always talk about it later. I'm going to tell you to take it all, roll it into little wads, and put it in your fire pit at the end of the summer.
Okay.
All of those things that you are getting, they're going to look very official. They are just advertisements. The federal government will only send you something in an actual envelope. So all of those like little postcard things, those are not coming from the federal government. They look very official, but on every single one of them, you will actually see at the bottom where it says, this is not from the government.
That's
So
really good to know.
be very mindful of that. The other thing is please do not go online and start Googling things. Don't click on things that say, yes, you can contact me. Because what happens is you will get 800 phone calls a day for the next 12 years. So please don't do that. The biggest thing is about 6 months before your birthday, you should probably reach out to an advisor of some sort. Yes, we want to be the ones that take care of you, but if you want to work with someone local, that's totally okay too. Reach out to them, let them know, hey, I'm going to be turning 65 in about 6 months. I need to get on your calendar to have a conversation. And then about 4 or 5 months before your birthday, you should be having that initial talk. And then about 3 months before your birthday, you should be signing up for Medicare Part A and Part B if you are not already drawing Social Security benefits. So if you're already drawing them about 2 months before your birthday, you're going to get a card in the mail. So no extra steps for you there. But if you're delaying your Social Security, you definitely want to make sure that you are reaching out and getting set up. It's a quick process, and just about any agent should be able to walk you through it.
Okay. Very helpful. So Part A, B, C, D, what the heck do all these letters mean?
So the alphabet soup, as we like to call it. Part A is what you've paid for while you were working. So that little Medicare line on your pay stub, that's actually you paying for your Medicare Part A in advance. Generally speaking, most people don't have a premium for that, and that actually covers the inpatient hospital care. All of your actual services that you receive while you're in the hospital and your doctor's visits and things of that nature, that actually falls under Part B. So unlike traditional health insurance, they are separate, along with Part D, which is for drugs. So you no longer have one health plan that takes care of everything. You have separate pieces that all work together. And the biggest thing about Medicare is that when Medicare is your primary, you can see any physician that accepts Medicare, but there's no annual out-of-pocket maximum. So whether you choose to go on a Medicare Advantage plan, which is Medicare Part C, like Charlie, or if you're choosing to go onto a Medicare supplement, you need to have something in place. And there are some pretty big, hard limits on when you can enroll in these types of plans. So for example, the 6 months before, the month of, and the 6 months after your 65th birthday, you have the opportunity to choose any health plan that you want with no medical questions. This is really important for folks that have even minor pre-existings like high blood pressure or cholesterol. Because after that 6 month period, you then get put onto where you have to go into Medicare Advantage. And Medicare Advantage is not having traditional Medicare. You still have it. It still kind of rides in the back seat. But you choose a third party to administer your health care benefits, which means that you're not subject to their rules and their networks and their copays and their costs. So it's just a very different experience than traditional Medicare, and any person that you talk to should absolutely be explaining both.
And so Medicare Advantage is Part C.
Yes.
And so I'm either choosing Medicare Advantage Part C or like A, B, and D.
Yep. And then
A, B, and D is one package and Part C is another package,
yes.
right?
Yes. So Medicare Advantage plans take your Part A, Part B, and Part D benefits and bundle them together. But you're choosing an insurance company to basically say, yes, you can go get that MRI. Yes, you can get that cancer treatment. No, you can't go to physical therapy. They're getting to decide where you get care, when you get care, and how often you get care. When you have traditional Medicare with like a supplement, which usually has a plan letter in most states like G, F, or N, that is where Medicare makes all of the rules and your supplement pays whatever Medicare doesn't.
Is F, G, or N, would that be on top of having A, B, and D?
It would be.
Yeah,
Yep,
I mean,
so
that's a chosen extra thing that you get.
It's a chosen and very highly recommended extra.
Okay.
So for most freshly turning 65 individuals, the cost of a Medicare supplement is substantially lower than what they will pay a month on the individual marketplace.
Okay.
So I can't give you an exact number, but I can tell you that For many people, knowing exactly what they're going to spend on their health care each year, even if that number feels large, is better than not knowing.
Well,
So,
those
and
known numbers are helpful for our planning, for retirement income planning
right,
purposes as
right,
well.
right.
Yeah.
Exactly. I mean, from a financial perspective, most clients choose to go on supplements because they can say, I know I'm going to spend X dollars on my health care for the next 5 years.
Uh-huh.
If you choose a Medicare Advantage plan, you're saying, okay, well, for the next 12 months, I might have to pay as much as X thousand dollars. But then next year, your doctors may not take that plan anymore. So now you have to choose a different plan. And maybe next year it's going to look different. And then the year after that, it's going to look different. And remember, you only have 6 months to choose a supplement. So for many people, they would rather pay a little bit more up front to know exactly what they're going to pay.
Totally. Do you generally see more Medicare supplement or not, or A, B, and D, or is it just totally depend, or is there one you see more than the other?
So we generally see a lot more Medicare supplements, partially because that's what we recommend, and partially because if you go and you talk to someone who is, say, 75 years old and has been on Medicare for 10 years, if you were to take a sampling of people, I would say that about 75% of them are going to have a plan F, like Frank.
Uh-huh.
So they're going to have that because that was like the Cadillac plan at the time. G has now kind of moved into that role, and so we're seeing a lot more plan Gs come across the board. But in general, that's where people want to be.
Okay. And do you see Medicare Advantage being superior or inferior commonly, or does it just totally depend?
There's a place for Medicare Advantage. It's generally going to be individuals that, one, either A, can't afford a supplement. Because,
Okay.
quite frankly, there are people that are out there that just cannot afford to spend the extra money. And we
Sure.
understand that. We still want them to have coverage, so we're going to recommend an Advantage plan. The other is individuals that are receiving assistance through their state government in the way of Medicaid assistance. So if we think about the different Medis, Medicare is to care for those who are aging and disabled, and Medicaid is to aid those in need. So this is going to be very low income folks that are getting help. The other is a very unique subset of people, and it is individuals that get 90% of their care through the Veterans Administration. So your retired service members or your disabled vets, if they're getting their care through the VA, a Medicare Advantage plan can open up more opportunities for them to get care for things like second opinions. But in general, I would say that 99% of my clients personally go on Medicare supplements. And the ones that don't, it's because it's genuinely not a good fit for them.
Gotcha. Very interesting. Well, anything else our listeners should know about Medicare that we haven't touched on a high level here today, Amy?
I mean, the biggest thing is if you're already on Medicare, you are going to be coming into the open enrollment. It starts on October the 15th and ends on December 7th. So if you're currently on a drug plan, there are so many different changes that have come for the 2025 plan year. Please reach out to the person who helped you enroll or reach out to us here at Move, and we'd be happy to help you evaluate that and better understand those changes. So October 15th through December 7th, very, very important. If you never look at it again, please let it be this year that you look.
Yeah, that's a great point. Thanks for bringing that up. I guess I've been maybe talking about it from an angle of signing up, but this is totally for people who are already on Medicare or already have health coverage. Move is a great resource for reevaluating and getting a second opinion. And you guys don't charge a fee for that. You guys get paid if someone implements a plan through you from the carrier. But tell us just a little bit about Move and yourself and how you guys work, when people come to see you, how those consultations look.
Sure. So Move Health Partners exists to make health coverage simple and clear. It shouldn't be as complicated as it is, and we know that, and so we try to make it as easy as possible. We are a brokerage that's located in Evansville, Indiana, and we specialize in working with forward-thinking financial advisors and their clients to help them navigate through early retirement, business liquidity events, transitioning to Medicare, kiddos that are coming off of mom and dad's insurance at 26 years old, marriages, divorces, things of that nature, because everyone should have an advocate to help them better understand their healthcare options. And that's what we do here. So our team, that's all that we do. We're not a call center. You're not going to dial a 1-800 number and get some random person. When you build a relationship with us, we're going to maintain that relationship with you as well. And we're going to be here year over year to help you navigate as you move forward.
Definitely. And how do you get paid?
So personally, I'm a salary W-2 employee, as are all individuals that are going to be working directly with clients. So the individual that you talk with, whether that's myself or one of my teammates, we are salary W-2 employees. We do not receive compensation based on an enrollment. So there's no commission grabs to be had here. Move Health can be compensated several different ways. If we recommend a plan for you and we hold a valid compensation agreement with that carrier, we may be compensated based on the type of policy you enroll in. So for example, whether I enroll you in a plan with a Kaiser Permanente plan or an Aetna plan, it doesn't matter. If it's an Affordable Care Act plan, Move Health gets paid the exact same way, no matter which carrier it is. And the same thing applies to Medicare supplements, Medicare Advantage plans. All of those compensations are actually federally and state regulated. So if we're making a recommendation for you, it is strictly because we firmly believe that that plan makes the most sense for you.
Yeah, I love that. Well, Move Health has been a great partner to us here at PCA. You know, it's something that is really helpful to have someone holding your hand through, and someone who does it day in and day out like Amy. So if you're listening to this and you want to understand your specific situation and how some of these things we talked about apply to you in your finances, reach out to myself, reach out to Amy directly. But like Amy said, they partner with financial advisors. And so PCA has specifically partnered with Move Health, and Amy is our person there, and the person that is going to be helping all PCA client and families, which is awesome because we're getting to know her and can build that relationship. We're not going to someone new every time or a 1-800 number like she said. And like Amy said, each health plan, just like the financial and retirement plans that we build for clients, they're customized. They have to be specific to you. So this is where couldn't encourage more to at least get a second set of eyes on your situation. Even if you think you have it all figured out, bring Amy in, talk with her for 15, 20 minutes or so, and just see if maybe there's something you're missing, because she's in this day in and day out. So Amy, with that, I thank you for joining us today. Great info. I think it's going to be well received. And I'm sure we'll speak with you soon.
All right. Thanks for having me.
Thank you for listening to Life Isn't Lived on a Spreadsheet. Click the follow button to be notified when new episodes become available. To ask questions about topics covered during the show, or get a copy of Making It Count, Life Isn't Lived on a Spreadsheet by Ryan Potterack, visit www.potterack.net or give us a call at 704-366-5776. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Potterack Capital Advisory. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Potterack Capital Advisory does not offer legal or tax advice. Please consult the appropriate professional regarding your individual circumstances. Nothing contained herein is to be considered a solicitation, research material, an investment recommendation, or advice of any kind. The information contained herein may contain information that is subject to change without notice. Any investments or strategies referenced herein do not take into account the investment objectives, financial situation, or particular needs of any specific person.
Product sustainability must be independently determined for each individual investor. Potterack Capital Advisory explicitly disclaims any responsibility for product suitability or suitability determinations related to individual investors.